Hello, welcome to ANA community. In this particular video, we are going to continue with the concept of a general examination. Today's topic of discussion is assessment of temperature. The term temperature, that is nothing but the heat production that's happening in the body. Normally, physiologically, so this can happen because of the various metabolic reactions. When this particular metabolic reactions is responsible for increased heat production because of the exposure to the any kind of the pathogen, or because of the poor loss of this particular temperature from the body, may be responsible for the increased temperature in the body. Whenever this temperature is increased, this is being termed as the fever. This is considered to be essential component of general examination. The term fever is being termed as persistent elevation of body temperature above the normal levels in an individual is being termed as fever or pyrexia. Clinical thermometer with a Fahrenheit or centigrade scale, specifically now with the centigrade scale or Celsius scale, is being used nowadays. Whenever if you see, this is the image of digital thermometer. This is the latest advent. Further, it is been considered to be the assessment, the gun, temperature gun. This is being used nowadays. So that means without any physical contact with the patient, we are going to check the temperature of the individual. As far as some of the rules for the temperature assessment while using the thermometer, so these are the following rules. It should be of reliable make, and the thermometer should be kept in situ for at least 2 to 3 minutes. So the areas where we are going to keep the thermometer is oral cavity, just below the tongue, then axilla, in the anterior axillary fold, in the groin region, or in the rectal region, even sometimes even in the external auditory canal. So these are the areas where we are going to keep the clinical thermometer. Oral as well as axillary temperatures are being recorded in the adults, whereas groin or rectal temperature are usually being recorded in the children or early childhood or in infants. While recording the oral temperature, the mouth should be closed and the mercury bulb of the clinical thermometer should be kept just below the tongue, that is in the sublingual region, and the breathing should be from the nose. Whereas while recording the axillary temperature, the sweating which may be present in the axilla, that should be wiped out, and the mercury bulb should be kept in the anterior axillary fold. While recording the temperature, the mercury should be well shaken down. So before using the thermometer, and that should be used after washing. To know about the type of pyrexia, the temperature should be recorded for every 4 to 6 hours to determine the type of fever. These are the rules that has to be followed while recording the temperature by clinical thermometer. When you think about the differences in the core temperature, peripheral temperature, in case of the oral temperature, that will be zero point 0.4 degrees Celsius below the core temperature, whereas the axillary temperature, that is up to 1 degree Celsius below the core temperature. These are more accurate readings when compared to rectal readings, because the heat production may be possible in the fecal matter due to the presence of fecal bacteria. Because of that, there may be a possibility of erroneous reading while recording the rectal temperature. Hence, oral temperature and axillary temperature are the most preferred temperatures as such. As far as stages of fever, what is it that the temperature variations, hypothermia is being termed as the fever or the temperature less than 95 degree Fahrenheit or otherwise less than 35 degrees Celsius. Subnormal temperature, that is less than 98 degree Fahrenheit or less than 36.6 degrees Celsius. Normal, 98.6 degree Fahrenheit or otherwise 36.6 to 37.2 degrees Celsius. Febrile stage, that is more than 99 degree Fahrenheit or otherwise more than 37.2 degrees Celsius. Hyperpyrexia, more than 107 degree Fahrenheit or otherwise more than 41.6 degree Celsius, that is being termed as hyperpyrexia. So the raised temperature, as we have discussed earlier, that happens because of two reasons. One, that is increased heat production or otherwise reduce heat loss from the body. Heat loss can happen because of one, through the urine or through the sweat and through the breath. So these are the three areas where extreme, that is the loss of temperature is possible. As far as types of fever, here it is considered to be the continuous fever. When the diurnal variations is not exceeding 1.5 degree Fahrenheit in 24 hours, this is the image of the extreme right topmost image. This is the image of continuous type of fever, where the variations will be less than 1.5 degree Fahrenheit, wherein the person will be having the continuous fever throughout the day. Whereas the remittent fever, wherein the temperature variation will exceed 1.5 degree Fahrenheit in 24 hours, and that will be and the person will be having the fever throughout the day. Whereas intermittent fever, this is the image of the second image. This is the image of intermittent fever, where the fever will be touching to normalcy for few hours during the day. And if this particular fever is being present every day, that means intermittent fever is present on every day, that is being termed as quotidian fever. This the intermittent fever, which is present on alternative days, that is being termed as the tertian fever. And the intermittent fever, that is being present on every fourth day. This is the image, extreme bottommost image, that is the fourth image, that is being termed as quartan fever. If the image, if the intermittent fever is not following any of these patterns, then it is being termed as irregular fever. As far as stages of fever, four stages are being present. prodromal stage, which may be absent some of the occasions. The next stage will be stage of onset or invasion, or otherwise initial or pyrogenetic phase, where there will be a raised body temperature will be present. Stage of full development, where the person will be having the full-blown symptoms of fever. And fourth stage will be stage of decline or defervescence or termination, where the person will be having a reduction in the fever. The accompaniments of fever, that means the symptoms are observed along with fever, that is, most of the occasions, onset of the fever will be insidious or gradual. Insidious in the sense where the person is not in a position to identify whether it is sudden or gradual, and the person will be having the serious consequences after the onset of fever. In that particular situation, it is being termed as insidious fever. Whereas gradual, in the sense the person will be having the gradual worsening of the fever, which is being present in the person suffering from typhoid. That is considered to be step ladder pattern fever. Or there may be sudden fever in case of pneumonia or malaria, etc. As far as the stage of defervescence or termination of fever is concerned, that may be observed either by crisis or by lysis. Crisis in the sense there will be sudden fall of fever, which will be observed in case of pneumonia, or there may be gradual fever, gradual reduction in the fever, which is being termed as lysis, which is present in typhoid. This may be associated with chills or rigors. Chills or rigors in this, the person will be having the shivering, which is again is considered to be due to the muscular contraction, which is responsible for the increased heat production in the muscles also. Thereby the person will be having the raised body temperature. Recurrent chills or rigors, that is specifically seen in persons having septicemia or pyemia or liver sepsis. Whereas the sudden or marked drop of fever or severe crisis, in the sense the severe complications are being seen in cases of collapse or delirium or death. As far as causes of fever are concerned, these are the possible causes of fever. Most common infections, either it may be bacterial, tuberculosis, or E. coli, or streptococcus, or cholera, etc. Viral fevers, influenza, mumps, measles, chickenpox, etc. Rickettsial or spirochetal or protozoal, such as malaria, etc. Fungal infections. These are the possible infectious diseases where the person will be having the fever. Neoplasms, specifically malignant tumors, allergic diseases, collagen vascular diseases, such as systemic lupus erythematosus, etc. Collection of pus, that is abscess formation inside the body, drug reactions, sarcoidosis or other granulomatous disorders, heat fever, factitious fever, inflammatory bowel syndrome, or pulmonary emboli. These are the possible causes of fever. Take-home messages from today's discussion. Temperature may rise because of two reasons. Either because of increased heat production or reduced heat loss from the body. Continuous, remittent, and intermittent are the different types of fever, wherein quotidian is a intermittent fever which occurs daily, tertian fever which is occurring on every alternative days, quartan fever, which is occurring on every fourth day, and irregular fever, which is not following any of these patterns, that is being termed as these are the different types of fever. Chills and rigors are the main symptoms of fever, as well as that may be associated with different systemic symptoms. For example, if the person is having a respiratory infection, he may be having chills or rigors along with cough, sputum, etc. Infections, inflammations, neoplasms, collagen vascular diseases, drug allergy are some of the causes of raised body temperature. Dear ANA members, what are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one topic that you'd like to hear in that channel? Mention in the comment box below. And spread this particular video to maximum number of true Ayurveda learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.